Team H is going to describe how population-based care influences patient-centered care and influences the development of practice guidelines and evidence-based practices.
I'm Dana. I'm one of the team members of Team H, and I'm here just to explain briefly in my own words what our educational outcome is. So for Team H, we got a population-based educational outcome, and the population-based care we don't really have much experience with, so I would say that we are novice and nowhere near advanced novice. The only types of things that we could have done to get there would be service learning hours and such things where we go out into the population and interact with others.
The objective that we've chosen is to interpret population-specific data to assess the health needs of the community or the population.
We will interpret and assess patients' data to help benefit the community's healthcare.
I can help reduce the amount of medications that get into landfills and clean water supply, and safely dispose of patients' medications and increase their knowledge of the risk of improper disposal of medications to the community and the environment. A challenge that I face is knowing facts about proper disposal and its effects on the community and the environment. I can overcome this issue and advance from novice to advanced novice by researching the topic and using a poster to present the information to other students, pharmacists, and the community.
My ICANN statement consisted of counseling on RX and OTC prescriptions within the population in order to increase their knowledge through feedback and reiterating each point. Challenges such as eye contact, good body language, and confidence, and asking open-ended questions to evoke conversation are all things I need to work on to move from novice to advanced novice. Furthermore, practicing on IPPEs and during work will allow me to reach my goals of gaining confidence and evoking conversation with my patients within the population by asking feedback questions and open-ended questions to elicit a response.
My ICANN statement consisted of vital signs and their importance in patients' health within the population. During my P1 year, I was first introduced to taking blood pressure, and I'm still a novice within this field. Maintaining proper blood pressure is very important for good health. Challenges such as proper technique will be mastered by practice during service learning hours and IPPEs. Altogether, I can work to master this assessment, and I will educate patients in the population on its importance in order to better their health.
I can counsel a patient on how to safely and effectively administer insulin and test blood glucose levels in order to get the full benefit of the medication and glucometer. The challenges that I face from going from a novice to an advanced novice of the use of glucometer is the fact that I have not had much exposure to using a glucometer, and in order to fix that, I will just practice more using a glucometer.
I can help the population in emergency crises with CPR and Narcan training. I am a novice in these areas, and I will practice with different populations and in my classes to be more competent as well. Challenges to this include educating the population on signs and symptoms of opioid overdoses, to not use opioids while driving or operating machinery, and how to take a Narcan training class and when to use the Narcan training class. Challenges to CPR training include educating the population about CPR, how and when to take a class in CPR, and feeling competent with CPR.
I can educate patients on the effective management of chronic illnesses such as diabetes and hypertension. To do this, I must focus on the individual needs of each patient. Some may need to make lifestyle adjustments, such as improving their diet and increasing their physical activity, which are difficult changes to make, especially with the demands of everyday life. We need to help them through it and find ways to keep them motivated. Others may need help reducing or coping with daily stressors, and it will take time and commitment to find which strategies are best suited to the patient.